Manual injections using platelet-rich plasma. This video is for demonstration purposes only. This is not a training video. Make sure that your patient has signed a consent form and has been given post-care instructions. Make sure to take before pictures so that you can monitor the patient's progress throughout the treatment series. A topical numbing can be applied to the patient's skin 30 minutes to 1 hour before treatment. The use of Pronox is another great option for pain management. Contact your local consultant for more information. Begin to prepare the platelet-rich plasma. Preparing the patient's PRP. Draw the patient's whole blood. Place the WorldPRP tube in the centrifuge to separate components and extract the platelet-rich plasma into a 1 or 3 ml syringe. Tear trough and nasolabial folds demonstration video. This is for demonstration purposes only. This is not a training video. Supplies needed for manual injection treatment with PRP for facial injections, tear trough area, or nasolabial folds. Platelet-rich plasma preparation. 25 gauge cannula, 40 or 50 millimeter, 3 cc syringe, dependent on injector preference. Recommended additional medical supplies: gloves, stanhexidine, gauze, sharps container, pain management if required.
So I start by cleaning the area. So usually look to see around the apex of the cheek, which is about 1 centimeter lateral to the canthus down and near the upper tragus area. And this is where I make my entry point with the introducer. So I'm going to pinch the skin. I'm going to feel a little poke now, 1, 2, 3, poke. And I leave the introducer in the skin for a few seconds in order to allow an opening. You can change the direction of the introducer to create another pathway if you plan to treat the lateral canthal area, which we will do today. So I'm making a 3-point entry here. And I twist the introducer a little as I come out, and I pull it very slowly out of the skin. Now I'm going to take my PRP. I have about a little over 1 ml of PRP attached to this 25 gauge cannula, and I'm going to enter in through where I made my entry point. So I'm going to pinch the skin, going to enter in, and unlike tear trough filler where we want to inject in the SOOF, just above the bone below the muscle, with PRP we're going into the superficial area of the skin. So typically you can see the outline of the cannula and you can tell that you're superficial. I always palpate for the orbital rim to make sure I do not pass the orbital rim before I start to inject. So my orbital rim is well above where the tip of my cannula is, so I feel comfortable to inject now. And I just do a very slow injection because this can sting a little bit as it comes into the skin. And I'm essentially injecting this in a retrograde fashion, doing small little linear injections and little micro droplets as I retract the cannula. Going into the lateral canthus. Making sure to stay away from the orbital rim. And injecting slowly. It's okay to see a little bit of swelling in this area. We do want to flood the area. Again, unlike filler, we want to see the skin raise in this area. And so that was a little bit over 1 cc in the right tear trough. Typically I aim to place between 1 to 1.5 cc's per under eye region. And same goes with the nasolabial folds. I typically aim to place between 1 to 1.5 cc's per side of the nasolabial fold. So now we'll demonstrate the right nasolabial fold. So I'm going to twist my cannula off of this empty syringe and attach it to my next syringe. All right, so now looking at the nasolabial fold, I tend to push down on the skin just to see how far the fold really comes. So I see it ending right about here. So this is where I'm going to make my entry point, as this will be a linear retrograde injection. So once again, I'm going to pinch the skin in the area where I want to place my introducer, and I'm going to go in slowly, 1, 2, 3, poke. And I'm going to wait a few seconds, usually 10 to 15 seconds before I remove the introducer. And always have a gauze ready in case the patient bleeds. Okay, so now once again, I'll take my syringe with PRP. I have the 25 gauge 50 millimeter cannula, and I'm going to enter in, and I'm going to go superficially in this area. So I'm going to actually turn the patient's face a little bit over to the side to make it easier for myself. And I'm just going to slowly advance the cannula up until I reach the corner of the nasal ala. And sometimes this area can be a little bit tight, so I will fenestrate in and out a couple times to create a little bit of a pathway, as well as to stimulate some collagen. And now I'll do a little fan in this corner here, slow injection, and now I will retrograde out in a linear injection. I can go back in and do another pass. And injecting quite superficially. Why we chose to do this treatment on this patient, which is PRP in the under eyes and nasolabial fold area, is the patient has never had filler before, and she's a little bit nervous about getting filler. So there are actually a lot of great reasons why you may choose PRP over filler for certain patients. So one great example is, again, a patient who is new to injections, perhaps a little bit hesitant to try filler just yet. This is a great introductory treatment in terms of injectables. And it's, minimal downtime. It's considered to be natural because we're using our own platelets, so a lot of patients like that. Another reason is certain patients, want to get certain areas filled, but perhaps they're not good candidates, whether it be their medical conditions or they truly don't have enough volume loss to properly place filler in that area. For example, with under eye region, certain patients have, large eye bags, or perhaps don't have enough volume loss, and we're trying to steer them away from doing filler in that area. Then PRP is a great alternative. PRP is also a great option for patients who are looking more for that preventative route. Perhaps they're starting to see just the very beginning signs of that volume loss and that aging process, and they kind of want to nip it in the butt. So they're looking to just, prevent those signs and boost the overall skin health. Another great patient that would be a good candidate for under eye PRP or nasolabial fold is someone looking to improve the overall skin health and brighten the under eye area. So a common question is, can you do filler and then PRP immediately after in the same area? I usually say, if you're doing filler first, you really want to wait and make sure that the filler has completely settled in this area and fully healed. So usually we say wait a minimum of 1 month before doing any other injectable procedures. We're now going to be treating the other side of the face. So we're going to start with the under eye region. So we always want to palpate this region first to determine where the border is, that orbital rim border, okay, because we do not want to pass the orbital rim border when we're injecting. And a little bit of a different concept than when we're injecting filler under the eyes. Filler we want to inject deep onto the bone, whereas with PRP we actually want to inject superficial and see a little bit of swelling and blebbing at the superficial aspect of the skin. The reason for this is we're trying to target the superficial to mid-dermis layer where we have the fibroblasts, and we're trying to stimulate that collagen. So I'm going to clean the area, and I'm going to start by making my entry point using the 23 gauge introducer. I'm going to pinch the skin. My landmark is typically around where I see the apex of the cheek. So I'm going to pinch the skin and enter in at a 45-degree angle. Little pinprick coming in, 1, 2, 3, poke. And I do a little bit of a pinching like this to distract the patient from the poke and hopefully make it a little bit more comfortable. I will wait a few seconds, anywhere from 10 to 15 seconds in the skin to allow the area to create a pathway. And then I will change the direction of the needle to create another pathway for when I'm going into the lateral canthal area. And now I will retract very slowly. And now I'm taking my PRP, just a little over 1 cc, attached to a 25 gauge 50 millimeter cannula. And I'm going to lift the skin up and enter in. And now I'm going to go superficially. So the moment I enter into the skin, I'm going to go perpendicular to the skin and just superficially advance the cannula. I know I'm superficial because I can see the outline of my cannula, and move it right up to the corner here. I'm going to palpate again for the orbital rim, and I'm below that. You can see the depth. And I'm going to inject very slowly in this area. And I just move my cannula a little from side to side as I'm injecting. Saving a little bit for the lateral canthus, not going past that orbital rim area, still staying superficial, and just slightly fanning the product in a retrograde motion below the corner of the eye and all the way on the side. And slowly retract the cannula. You can apply a light amount of pressure, but you don't want to push too hard because this area can feel sensitive immediately post-injection. And as you can see, the area is swollen and lifted up. That's exactly what we want to see. Moving on to the left nasolabial fold. Once again, I'm going to clean the area. I'm going to push down on the skin to see exactly the track of the nasolabial fold and where it ends. So from what I can see, it's ending right about here. So this is where I'm going to make my entry point. Some people it stops shorter, others it comes all the way down. Her nasolabials are not very deep, so that's great. She's a great candidate for this treatment because she wouldn't be a candidate for filler. So once again, I'm going to pinch the skin and just enter in at a 45-degree angle with the 23 gauge introducer, little poke coming in. And I'm going to leave it in the skin for about 10 to 15 seconds. And then slowly remove the introducer. Coming in again with just a little over 1 cc of the PRP attached to a 25 gauge 50 millimeter cannula. Going to clean the area and enter in. And I'm going to tilt her head a little bit over to the side to help myself with the angle. And the moment I enter in the skin, I go immediately perpendicular so as to say superficial. And I'm going to advance the cannula up to the corner of the nasal ala. This area can be a little sensitive. And then I'm going to fan a little bit of product in this area. And then retrograde the remainder out. You can fenestrate the area to stimulate a little bit of collagen, and then retrograde out. So injecting linear retrograde as I come out.
PRP Hair Restoration Manual Injection Demonstration Video. This video is for demonstration purposes only. The following is not a training program. Supplies needed for hair restoration PRP injections. Syringe and needle size suggested: 27 gauge ½ inch or 30 gauge ½ inch needle with a 1 or 3 cc syringe, or 30 gauge 2 mm needle with a 1 or 3 cc syringe, dependent on injector preference. Number of syringes will be determined based on the volume of PRP preparation needed, patient dependent. Recommended additional medical supplies: gloves, stanhexidine, gauze, sharps container, pain management if required.
So we're going to be treating this patient's scalp now. She's been experiencing some hair loss and hair thinning, so we're hoping to try to target the dormant hair follicles and stimulate that new hair growth. So the injection pattern we're going to follow is placing the injections at about a 2 millimeter depth, 1 centimeter apart. So I'm going to start just near the hairline here. And I place approximately 0.2 per bolus.
Our nurse injector trainer, Victoria, is using a 30-gauge half-inch needle with a 3 cc syringe. The technique Victoria is using is a serial puncture microbolus with superficial injections at a 2 millimeter depth, spaced approximately 10 millimeters apart, depositing between 0.2 to 0.3 cc's of PRP. Recommended treatment series for patients is 3 to 4 treatments spaced 4 weeks apart. Victoria is treating the patient for alopecia, which is a term used for thinning hair. This is very common in both male and female clients. Victoria begins slightly in front of the hairline, following a pattern to ensure she has full coverage. When speaking to the patients, we like to explain the treatment such as planting seeds. PRP works in 2 different ways. Firstly, because of the physical injections, which cause an inflammatory process to the area. That increases blood flow, and with that increased blood flow, we hope to stimulate hair follicles. Secondly is the actual PRP being injected, explained to patients as fertilizer. With each injection, depositing a small amount of PRP in each section fertilizes the hair, creating a more optimal environment to stimulate the hair follicles to start growing. The discomfort level for most patients is around 4 out of 10. Pain is subjective, so it really is patient dependent. Pain management can be offered to the patient if needed.